Hi, I'm Dr. Lauren with Abundant Life Health Center, and in this video we're going to be showing you the general wobble exercise. This exercise is the single-handed exercise that will mobilize the entire spine. That's the cervical, the thoracic, and the lumbar. It also will help elongate the muscles and tissues, along with help heal ligaments, and it will also bring the cerebral spinal fluid in your body to circulate through those discs to rehydrate them. The cerebral spinal fluid is fluid that is in a closed system that goes around the brain, down your spinal cord, and then back up. This fluid will help with the core temperature of your body, but it also brings the nutrients needed to go in the discs and out for the healing process. In the average person, that circulation of the cerebral spinal fluid happens only once a year. The amazing part about this exercise is when you do all three components of this exercise, it's going to circulate through once. So instead of once a year, you're going to have it twice a day. That's why we actually in our office recommend for anybody to do this exercise as long as they know how to follow direction. So you could always tell your family and friends to be able to do this exercise before they have their nerve system checked. Once they have their bodies checked, we would be able to be more specific about this exercise. When you're using the exercise, you're going to be using your wobble cushion that comes in your home care kit. You want to make sure that the pointy side is face down. You'll want to use it on a chair such as this that has a flat surface, or even a flat surface that is a little bit wider like a bench. You do not want to use an exercise ball because you're not going to get the proper movement and you won't have the proper results. I'm going to have Jamie come on over so you can see this exercise. The first component of this exercise that you're going to be using is side to side. When you're doing this, you're going to drop down your shoulder and your hip is going to come up. So you're going to feel the movement in that pelvis and you're going to be going side to side. One mistake that could happen is you're not going to be moving that pelvis and you're going to go side to side just like this. That is not the proper way. Also, you can have some rotation going on, so side to side with that rotation. That is not the correct way. You want to make sure you're nice and square and you're going side to side, moving that pelvis, and it's not a stretch. You want to make sure you're doing it pretty vigorously. Refer to your spinal rehabilitation sheet to see the repetitions that you need to do. And when you're doing these, one, left and right count as one, not 1, 2, okay? Now we're gonna go on to the second component of this exercise, and that's the front and back. When you're doing this exercise, you're gonna have your hands on your thighs, and when you're going front, you're going to push your pelvis backwards, round those shoulders out, and put your head down. When you're going back, you're going to arch that lower back, stick out your chest, and look up to the sky and bring your arms back. One mistake that could be made with this is that you're not moving that lower part of that pelvis and you're just bending your shoulders, rounding them front and back. That is not the proper way. You want to make sure your whole entire body is involved. The next component and last component of this exercise is going to be rotation. Now with rotation, you're going to put your hands right in front of your, down below your chin, and you're going to rotate your entire body one way, including that head, and rotate the other body the other way. A mistake that could get made during this exercise is leaving your head straight and you're rotating around there. That is not the proper way. You want to make sure that you rotate the entire body. I'm going to have Jamie turn to your side so that way you can see what it looks like from the side view. We're going to have her do side to side where she's going to go down on both sides. I'm also going to have her do front to back where she's arching back and forth. And then rotation, she's going to have her hands up and rotating that entire body, including her head. Also look how fast she's doing it. Once again, this is not a stretching exercise. This is going to be a warm-up. So you will be a little bit sweaty afterwards. Once again, this is the general wobble exercise, amazing for anybody. And I'm Dr. Lauren with Abundant Life. Remember to live abundantly.